Life was full and normal for Gertrude Nachigude, a youth in her mid-20s. She envisioned a family with kids playing in the park and on the beach. All this came to an abrupt halt when she was diagnosed with breast cancer. Would she live the life she sought? Would she be able to get the children that were to make her life full of bliss?
A woman, when you deliver, you're supposed to breastfeed. And another thing, breast is connected to the rest of the reproductive system, because breasts have a direct connection with the ovaries. Because when the ovaries are active, the breasts are definitely active. So it's a set, it's part of the set of the reproductive system.
She is alive today because she was able to sacrifice one of her breasts in time. That was 8 years ago, and took her a year to realize that the painless lump she felt in her breast was indeed breast cancer. The cancer that was afflicting her affects both men and women, with the latter being more susceptible to the disease. Dr. Lem Jackson, head of Uganda Cancer Institute in Mulago Hospital Complex, says women are more at risk due to their hormonal makeup. According to the doctor, Gertrude's fears were not misplaced. Breast cancer treatment affects reproductive health in that it disorganizes the hormonal makeup of the ovary.
The question is, some of the drugs can actually affect the ovaries. In other words, they can reduce the formation of the ovum. And that may introduce element of relative infertility, because those are organs where the cells reproduce quite rapidly, and treatment with chemotherapy can actually reduce their rate of replication.
A breast is a show of femininity, and to have it cut off is a pain many women don't want to imagine. Reproduction is affected since a patient is advised against breastfeeding, which may affect the development of the baby.
Because if you do that, then you are subjecting the baby to toxic chemicals in the drug used for the treatment, which will be transmitted to it through breast milk. And this can affect the young growing cells of the baby adversely. So there is a contraindication there. There is no breastfeeding while somebody is undergoing treatment for breast cancer.
Humanity tends to stigmatize conditions that do not afflict them, and Gertrude got the taste of it when it became known to her that one of her breasts was to be cut off. She says breast cancer patients in Uganda have to fight against stigmatization.
They don't want to identify themselves with the disease, because people think maybe the cancer is a curse or something, because the cause is not known, so people don't know who should have the disease. So even those who have had the disease and they've been successfully treated do not join us, because they don't want to be associated with the disease. Because to most people think cancer is death. So when you have the disease, then it is death within either your family or any time you die.
This forced her and others to come up with an association, the Uganda Women's Cancer Support Organization, UOCASO, aimed at sensitizing women on the disease, as well as being a unifying body for patients and survivors. There are currently 40 members. Gertrude, an accountant by profession, might have been lucky to detect the carcinoma in time. But this is not the same with many women in Uganda who detect the disease in its advanced stages. Dr. Deus Twesije is a cancer surgeon at Marara Referral Hospital in southwestern Uganda, and said they are witnessing a surge in the number of patients that come for cancer treatment.
Probably there is now more of sensitization, and people detect those problems, end up coming here for some advice. I've had some scenarios, for example, with these old mothers who have got breast cancers. Some of them have told me that originally they used to have that scenario where they get locally, they get burnt. You get a swelling in the breast, then somebody hits a sharp metal and burns that swelling. But in this case, they don't allow those swellings. They prefer first to come to the hospital.
But Mbarara Hospital has no CT scans for cancer treatments. The best they can do for the rural women is performing surgeries and cutting off infected breasts. He says the theatre has little space and therefore they are forced to work on emergencies like accident victims, leaving breast cancer operations to a delay, while advanced cases are referred to the Cancer Institute in Mulago. The institute is constrained, drugs are insufficient, while each cancer patient needs a dose worth at least 1.5 million shillings. The drugs are hard to come by, with all blame directed to the national medical stores.
There are 28 drugs that are called essential cancer drugs. And at any one time, these drugs must be in supply in a cancer center like ours. And as I talk now, not even one of those 28 drugs is actually available here.
Gertrude's struggles with breast cancer have revealed that women's ignorance of the disease is responsible for the high cases. Through her organization, Gertrude is reaching out to many women countrywide to spread the gospel to their fellow colleagues. She cites cultural practices as a hindrance to the fight against cancer.
Well, people are ignorant because of, I think, our culture. We don't have a culture of reading, of knowing things. Even those who have the access don't even have the time to read. And also we have a culture of not caring for our health. We always report the pain. So why, when you don't have a pain, why do you bother to know about something that has not pained you? So people are ignorant about the disease, and even the services available, the policies. I mean, we don't have a cancer policy in the country.
The Ministry of Health has joined the fray against the disease.
The viability of drugs depends on the patients you have. So I've ordered the Ministry, the Permanent Secretary, to give to 200 million to Cancer Institute so that we can have those drugs immediately. Meanwhile, when we are formalizing.
It is very, very positive, and actually we are working out a partnership to work with the ministry to scale up our work, because we've been limited to Kampala and maybe Mukono and Mpigi because of funding, but at least the ministry is very, very positive about having the services across the country.
Most Ugandans are below the poverty line, and meeting the treatment cost for breast cancer is a high mountain to surmount by countryside women. So many die. A few lucky ones may find a private clinic for prescription, but Dr. Lem warns against this.
Treatment should never be attempted in a private clinic. Cancer treatment should always be given at a cancer center, because at a cancer center there is always the backup and the expertise that is needed for administering the drug in the first instance, and also for countering the side effects of the drugs. And these capabilities, private clinics, at least in Uganda, they don't have.
The changing lifestyles may be responsible for the increase in breast cancer, but women need more knowledge on the trigger factors for the disease. These include being a woman, delayed childbearing, especially for the elite class, genetic factors that are responsible for the disease in men and some women, smoking, eating junk foods, among others. Gertrude and Dr. Deus agree that sensitization on the disease is the way forward if ever the disease is to be controlled. This will reduce stigmatization and increase early self-diagnosis by women.
We need to be vigilant in the form of sensitization and, to sort of make a vigilant cancer team, and eventually expand on services, especially chemotherapy and radiotherapy, maybe to more other centers other than being centered in Mulago National Referral.
We need to tell people that this disease is with us, and it's a problem right from the health, from the policymakers to the health, the structures. I think awareness is the most important that can be done, because if there is awareness, probably even the health sector will come up and say, wow, this is a problem, because they may not also know whether it's a problem or not.
Dear Ugandans, as we plan to fight breast cancer, it's imperative that efforts should be made to detect the disease in its early stages. It is high time that we adopt public education towards breast self-examination because it's practical and affordable. Let us join the fight.